We know COVID-19 is not an equal opportunity crisis. It's revealed cracks in the system that leave the most vulnerable exposed. Low-income and racialized communities have been hit the hardest. But there is another group that feels abandoned and ignored: people with disabilities. And there are fears some of them are considering assisted dying as a last resort.
It's like I'm being punished for being born disabled.
Life has not been easy for Kim. She says she was born with a digestive ailment and after several surgeries has had most of her intestines removed. She needs a feeding tube and survives on Ontario Disability Support Payments, or ODSP. A single person with disabilities in Ontario can earn a monthly maximum of $1,169 in social assistance. Kim also receives a food subsidy of $250 a month due to health issues. She pays $1,000 to rent a 300-square-foot RV in a trailer park, leaving her $421 for all other expenses. She borrowed a friend's iPad to do this interview.
There's no extra money left over because I also don't make it to the end of the month for food at all.
She's not alone. Search the hashtag ODSP and you will see the cries for help. This man tweeted after paying rent, he only had $2 a day left for food. Another said they had $3.87 for the entire month after paying for medicine.
Some learn to get the potatoes and enough margarine so that at the end of the month, it's called the potato diet. And it's one potato a day at the last 2 weeks.
Advocates have been fighting to raise ODSP for years. In 1995, when Mike Harris was premier, he cut it by 21%. This chart, provided by the current government, shows in 1998 a person with disabilities could receive up to $930 a month. 22 years later, that amount has gone up by just $239. That works out to 65 cents more per day.
Well, essentially, social assistance recipients are getting poorer every year because the rate goes up every year. We're forced to make more out of less.
Before the last provincial election, Kathleen Wynne's Liberals promised to raise ODSP by 3% a year, 3 years in a row. Doug Ford's government cancelled that in 2018 and raised it once by 1.5% instead, a 7.5% gap. According to his government, there are 380,000 ODSP cases at a cost of $5.3 billion a year. COVID has made things more dire. A Stats Canada survey released last week found 61% of people with disabilities are struggling to pay rent or buy medication as the cost of living goes up. What is especially chilling, some people with disabilities are talking online about applying for medically assisted dying, known as MAID. This person tweeted they enrolled because they can no longer afford to live. Kim says she knows of 50 more who have applied. Others, she says, are taking other routes.
Many of my friends, I've lost 6 friends to suicide.
It's hard to know if applications to MAID have increased since COVID, particularly among people with disabilities. In an email to CityNews, the federal government stated those numbers won't be available until the spring. It appears there is no mechanism to raise red flags.
They don't want to live this way anymore. You know, there's no safety net at all.
Kim admits she has thought about applying for MAID herself. Her landlord is evicting her, she says, because he can get an additional $400 a month on Airbnb, and she doesn't know where she will go next.
I have no dignity left. I don't like to go anywhere or anyone to see me. I just don't feel like I'm worth anything to anybody anymore.
Doug Ford has repeatedly said there is no money to increase monthly ODSP payments. He recently suggested they should get a job. Advocates say it is extremely difficult, if not impossible, for many people with disabilities to find employment. And even if they could, their earnings would be clawed back.